Thank you. And thank you for inviting me to speak here. I hope you can hear me. Good. It's a very unenviable task. I've got 5 minutes. I'm the first speaker, and we're talking about COVID in India, a hugely difficult topic to talk about. But I think I'm going to assume that people understand the scale of the devastation, and maybe that some of our later speakers will talk about the scale of the devastation that's occurring, so that I can kind of focus maybe on rewinding a little bit and trying to come to an understanding of how we came to this point. So I've been tracking the epidemic from very early days, and it's not been easy. I think that's the first thing to say. It's not easy because the data that you have to use to try to track an epidemic like this is often very, very limited. There's two reasons why the data is limited. One is that the kind of systems and structures by which data is being gathered are kind of sometimes inadequate. But another reason why the data that you can use to try to track an epidemic like this is limited is because of what we can call deliberate dishonesty and data fudging, which has become very, very widespread. Or rather, I should say it's been fairly widespread right from the early days. So we've got two kind of overlapping difficulties in understanding the Indian epidemic. What this does is it makes it very hard to disentangle what's going on in terms of epidemiology, in terms of the virus, and what's going on in terms of politics. The two overlap in a very kind of essential way, because we get little pieces of information which are partial and often sometimes incorrect as well, and we have to try to infer what's going to happen next on the basis of that. So I feel this has been kind of one of the huge challenges of trying to understand India's epidemic. Anyway, let me rewind a little bit and let me say briefly what the kind of trajectory has been. So I think we all know that disease started to spread around February to March, a lot of it under the radar in those early months across the country. By late March, you had a national lockdown. And one of the controversial and difficult questions is to understand what the effects of that national lockdown were. We understand that, of course, it caused huge misery and devastation. You had the migrant worker crisis. You had people who were kind of trying to get home, walking literally thousands of kilometers along highways. So you had that aspect of it, but also you have to ask, well, what did it do to disease? And I think it did a complex mixture of things. We found that disease continued to spread very fast in the urban slums. That's one of the things that lots of different bits of data tell us. We found that it was slowed but not halted in urban non-slum areas. So it still spread in building societies in non-slum areas of cities. And probably, if you can talk about one success of the lockdown, one positive thing, disease was kept to fairly limited numbers in rural areas. So that you can say was probably one of the things that came out of national lockdown, although at a huge cost. Of course, that lockdown was not sustainable. It was a series of lockdowns, and as they eased, you had people going back to rural areas, including migrant workers, and many of them, of course, coming from the slums where disease was raging. And of course, disease spread to rural areas during that period of time. So you entered another phase where you still had lots of restrictions in place. You still had the disease slowed by national lockdown, but it was spreading much, much more widely. And also, one of the things which had happened was you had different things going on in different states, but then gradually, as you had opening up, you started to see spread basically across all states, some coming in later than others, but you essentially saw a national epidemic instead of a series of local epidemics. So that's one of the changes which happened. As you had the kind of later part of the year, as you went into September, October, November, the last part of 2020, you started to see things winding down at the national level, but actually that winding down of cases and in deaths that you saw happening at the national level hid another story, which is that you continued to have spread in rural areas. We know this because there were serosurveys done, which found that there was a very large jump in spread in rural areas towards the end of the year. So actually the data that you see coming out, the case and death data, actually often hides a more complicated picture because some regions are much better surveilled. We know what's going on because they're kind of testing quite well and deaths are being picked up. And then there are parts of the country where surveillance is extremely poor. Anyway, we come to the point then where you have this kind of pause between the two waves. You have a second wave approaching. We don't yet know it at that point. And you have all sorts of narratives, which I won't go into because they're too kind of long to go into, but you have all sorts of narratives which are both contradictory and wrong about how India is past the worst. You have this huge complacency developing. You have big religious gatherings. You have long drawn out elections. you have an achingly slow vaccination drive precisely because it seems that nobody up on high seems to be anticipating that there's a new wave coming. Even once the data starts to come, so by mid-February, it's very clear that you've got something going on. By early March, it's intensely clear to anyone watching the data that you've got a new wave and it could be devastating, and it's coming our way, and many people are writing about it by this point. And at this point, you still have the health minister, for example, saying that we have beaten COVID, that, COVID is kind of over. And you have government-aligned modelers saying the same thing. That's another long story I won't go into, but you have people who are supposedly scientists backing up this patently incorrect narrative. And I think I'll leave kind of the rest of maybe what I hope to say to questions, because I want to really stick to my 5 minutes. But what I do want to say is that the huge data gaps combined with people being prepared to be on message without actually looking at the data. So, just kind of scientific people who are supposedly part of India's scientific community backing up a message which is not credible and is at odds with the data, I think have led us to this point of huge devastation that we're seeing at the moment.
We have a lot of questions, some really interesting ones. So I will direct them at the speakers and perhaps they can take them one by one. So we have the first one for Murad. Murad, are you around? Is he there?
Yes, I'm here and I'm now unmuted.
Wonderful. So the first question is for you, and this one says, will we ever be able to figure out the exact scale of the devastation in India in terms of numerical figures, given the limitations that you've put forth?
I think that it'll be very difficult to figure out the exact scale, but I think that as time goes on, we'll get a better and better idea of what the scale has been, because there are different sources of data which will continue to come in. We'll have eventually some SRS data from the census. So this is sample registration survey data, which will be able to tell us about mortality. It won't be perfect. It'll give us estimates, not exact numbers. We'll have hopefully other bits and pieces of data. There are a number of different surveys which are carried out routinely. And and there might be surveys which are not carried out routinely, which are done eventually to actually map the kind of toll of the pandemic. So my hope is that some of that will be done. But in the short term, we're looking at really just trying to estimate in a very broad way the toll and see just how much huger it is than what we're actually seeing in terms of numbers of cases and deaths.
Thank you, Murad.